Here's something that might surprise you. Telling someone with addiction to just stop is about as effective as telling someone with diabetes to just make more insulin. And yet, that's exactly how we have approached addiction for decades. Today, we're going to understand why that doesn't work and what actually does. Let's start with what addiction actually is. The Australian National Drug Strategy defines addiction as a chronic relapsing brain disorder. And that's crucial. It's recognized by the World Health Organization, the American Medical Association, and medical bodies worldwide as a disease, not a character flaw. Now, in my 3 decades of working in addiction medicine, I've seen countless people who have immense willpower in other areas of their lives. They've built businesses, raised families, overcome incredible obstacles, yet they struggle with addiction. Why? Because addiction fundamentally changes how the brain works. It hijacks the very systems that govern decision-making, impulse control, and reward processing. Neuroimaging studies show that chronic substance use actually alters brain structure and function in regions like the prefrontal cortex and limbic system. These are the areas responsible for judgment, planning, and emotional regulation. It's not about being weak. It's about brain chemistry that's been fundamentally altered. Here's where it gets really interesting. Addiction essentially exploits our brain's survival circuitry. Your brain has evolved over millions of years to remember and repeat behaviors that help you survive, finding food, avoiding danger, forming social connection. When you use an addictive substance, it floods the brain's reward system with dopamine, sometimes up to 1,000 times the amount you'd get from a natural reward like eating or sex. Your brain essentially learns this is critically important for survival. Remember everything about this experience and repeat it. This is why cues become so powerful. If someone always used drugs in a particular location or with certain people, or when feeling stressed, these cues become triggers. The brain has learnt to associate these situations with the behavior, creating what we call conditioned responses. This isn't a choice, it's automatic, like flinching when you touch something hot. And here's the kicker. Over time, the brain adapts. It becomes less sensitive to dopamine, so you need more of the substance to feel the same effect. But critically, you also get less pleasure from natural rewards. Food doesn't taste as good, relationships feel less rewarding. This is called anhedonia, and it's a major driver of continued use. So why doesn't willpower work? Well, because willpower relies on the prefrontal cortex, the brain's executive control center. But addiction impairs that very system. It's like trying to steer a car with a faulty steering wheel. Add stress to the equation and it gets worse. When you're stressed, your body releases cortisol, which further impairs prefrontal cortex function and amplifies the reward-seeking circuitry. This is why relapse rates spike during stressful periods. It's not weakness, it's neurobiology. I've worked with patients who have incredible determination. They've overcome homelessness, rebuilt careers, mended family relationships. But without addressing the underlying neurological changes through medication-assisted treatment, cognitive behavior therapy, or other evidence-based approaches, willpower alone rarely succeeds in the long term. Research from the US National Institute on Drug Abuse shows that 40 to 60% of people with substance use disorders relapse during recovery, similar to relapse rates for other chronic illnesses like hypertension or diabetes. This tells us that addiction requires ongoing management, not just a one-time act of will. If you're struggling with addiction or supporting someone who is, here's what matters. First, drop the shame. You're not dealing with a moral failing. You're dealing with a medical condition that requires proper treatment. Second, seek evidence-based treatment. This might include medication-assisted treatment, counseling, support groups, or a combination. Just like we wouldn't treat diabetes with willpower alone, we shouldn't treat addiction that way either. Third, understand that recovery is possible. Brains have remarkable plasticity. They can heal and rewire, but it takes time, support, and the right interventions. Understanding addiction correctly isn't just intellectually satisfying, it literally saves lives by reducing stigma and directing people towards effective treatment. If this has been helpful, subscribe to MedHeads for more evidence-based health insights. I'm Dr. Fergal Armstrong. Stay well.